Let's look a little more into cone beam then, because I'm relying on cone beam. I wanted to communicate the low dosage, the skin entrance dosage that is occurring. So daily ambient is 8 microsieverts a day. So do the math, 7 days in a week, 56 microsieverts a week. 56 is what you get in natural sun, a couple hours a day out and around. Airport body scan, cross-country flight. So airport, 5 to 10 microsieverts. If you go through that scan, 400 cross-country. Medical and so on are way up as far as numbers. So what we get with the scan is actually less than ambient in a week. So microsieverts, periapical, pan, ceph, full mouth. Look at the full mouth x-ray the dentist does that nobody hesitates with every couple of years, get another full mouth, or sometimes maybe it's 5, but certainly some regular x-rays. We can take and create ceph pan with 20, 30 microsieverts if it's a limited field of view, and of course, broader field of view for craniofacial or other things we're looking at, airway, we're going to have more, but it's certainly not a risk factor. So it's not even something where we kind of, sort of think there's too much. The technology is so good, and there's such a minor, limited signal that's necessary for the software to recognize and pick up the attenuation and identify what are dark and light objects, and we can colorize it based on software. So you and Mike are doing a great job talking about these things to help people understand better. But I just want to emphasize, depending on the articles we're reading and depending on whether it was 10 years ago or 5 years ago or now, the technology just keeps getting better. So there's less microsieverts necessary to create the image. And we've become very talented at the field of view we're selecting, and then how we're rotating the data, and then the screen prints we do and how we view the data. So it's become really good. I was an early adopter there that started giving us the software and imaging. And then, yeah, there's a cost, but to me, it was the cost benefit. And I just decided it was worth it. So we begin to understand with 3D about capture, attenuation, radiation safety, software. This stuff is way better with cone beam than we ever had.